As a specialist, I get to see a variety of dental concerns that patients present with. And I know that today we have dental implants that helps to improve the support for the dentures or prosthesis, which I call it. But there are patients who have been comfortable with their dentures for a long time. And if you're really comfortable with your denture and need a new dentures, and we'll discuss this case in a minute, we can make you new dentures. They've been working for 100 years. Just because you have dentures does not mean that you need dental implants. In many ways, dentures do the job just as well as an implant would, although it gives you a bit more support when you have dental implants, there's no question. But for those patients, this video is specifically for those patients who are just considering replacing their existing dentures with new dentures, or they have a terminal dentition. What I mean by terminal is that, let's say, the upper teeth need to come out and they want dentures and the dentist says you need implants, etc. But that's not the issue. My job as a specialist, my position as a specialist, is to be able to diagnose your problem, plan your treatment plan that suits your comfort, your function, and your financial needs and your aesthetic needs. In this particular patient, she had a failing upper bridge work and against lower full denture. And she's been comfortable with this denture for the last 35, 40 years. And when she was confronted with her, she was another specialist who said, oh, we need to place implants, we need to graft your mouth, etc. Now, for a 77-year-old lady, this was not an option. And she was dismayed, so she stayed at home crying for weeks and weeks, saying, what's going to happen to me? Until her son said, you better go and see Dr. Sarkis. And that's how we started the ball rolling. In the initial presentation, we explained to the patient what needs to be done. We improved the existing, whatever that was terminal teeth, we improved the health of those teeth. So in terms of health, improves the health of the oral tissues. So number one thing I look at things is see how healthy is your oral tissues. So before we proceed, we don't want to take quick impressions, etc. Just make sure everything's healthy. We gave her the health, and she was very good in maintaining that healthy tissues, after which we provided a temporary partial upper denture and a new full lower denture, and then that was, with time, we transited with a temporary upper denture. One tooth at a time was added to the upper partial denture that allows a simple transition from a partial dentures with a partial teeth remaining in the mouth to a full upper denture. That gave it that confidence and that comfort in slowly transiting from like terminal teeth that are about to be lost. While she's wearing a partial upper denture, we slowly went step by step, gave her tooth at a time, and gave her that comfort, and until she finally transited to the full upper denture. We made a temporary upper denture, and then she got coped with that very well. And we also rearranged teeth to make sure that she was really happy with the tooth arrangement. Some of that, should bring your old photos with you. So that allows you to get the right tooth shape and the height and all the important ingredients that we can reconstitute the new dentures with, you see. And for this patient, we had to open the bite by about, I think, 6 millimeters. You can see on the images the difference between the old denture and the new denture, how high the old denture is and how much area it covers compared with the old denture. So we need to cover big area in your mouth to get a nicer support that gives you comfort. And that's really, really important that we do that for you, because the lower denture doesn't have that resiliency of the tissues that the upper arch has. With the upper denture, it's much easier to wear than a lower denture. That's why in many ways we prefer to have like even one single implant in the middle of the lower denture that gives you good support. And we've got plenty of data that says they're about the same sort of thing as having 2 implants. But in many ways, my experience has been a lot with the 2 implants and lower to make an overdenture. Like if you look at a patient, the facial atrophy section, which is facial atrophy is when accelerated aging is when we made a 2 implant overdenture for a patient. And he said that for like last 15, 20 years now against the fixed upper implant supported bridge work. However, coming back to our case in the view is that we were able to accomplish the transition from a failing teeth on the upper arch that was supporting a partial denture. We added a tooth at a time to that upper partial denture to create that easy transition period. We made a new lower denture, which was a larger covering a large area in the tissues, giving me that nice suction effect. And we had the same sort of suction effect on the upper arch, so the patient just feels really confident. And what I normally do, I get like a cotton roll. You've seen the cotton rolls in dentists. I give them a bite on that denture and just pull it, and she actually dismembers the cotton roll. That tells me that the patient can have a good compression on the tissues without pain. Also the fact that the dentures are made to accommodate all the important anatomy, to fit within the anatomy of the mouth, that she can comfortably hold it with her muscles and position it and pull. That means she can eat well, chew, she can eat most of the things that she finds it easy way. I mean, she even bites a carrot with it. But the issue is that it was made specifically for her, looking at all the anatomy in the mouth, looking at all the tissues, how the tissues and the prosthesis come together, so that becomes part of her anatomy and physiology. So it's more or less these dentures are part of her body now, and that's what we want the final result to be. It's important to understand that making dentures is not a quick fix. It takes time, and for those patients who really want the specialist care in constructing new dentures, we'll be more than happy to see you, and naturally can do the same for you.